All right, let's talk about the NORCET exam, specifically that Nursing Leadership and Management syllabus, which, let's be honest, can feel like an absolute beast. But don't you worry, today we're going to tame it. We're going to give you a super simple framework and a clear path to get you to success. Let's jump right in. First off, let's just call it what it is. The official syllabus is massive. It covers at least 9 major topics, everything from planning and organizing all the way to legal ethics. When you're staring at a list that long, it's easy to feel completely overwhelmed. You're probably thinking, where do I even start? Well, the answer is actually simpler than you might think. We're going to break this whole problem down into just 2 parts. First, we're going to tackle the what. That means figuring out the key knowledge areas you absolutely have to know. Then we'll get into the how, which is a winning strategy to actually learn and apply that knowledge so you can crush it on the exam. Okay, let's start with the what. Now, instead of looking at the syllabus as just some random, terrifying list of 9 topics, we're going to organize it. Think of it like a knowledge map. This is going to make it so much easier to see the big picture and how everything actually connects. So here's the trick. We can take all those intimidating topics and group them into just 3 memorable pillars. That's it, just 3. Think of it like this. Number 1, building the foundations of management. Number 2, leading people and resources. And number 3, ensuring quality and ethics. Let's quickly break down what's inside each one. Pillar 1, foundations of management, is your bedrock. This covers the core functions like planning, organizing, and controlling. You can think of this as creating the rulebook for your unit. Developing patient safety policies, setting the mission for your team, or even just understanding the hospital's chain of command. It's the essential stuff. Pillar 2 is all about leading people and resources. This is the human side of the job, and it's huge. It answers questions like, who works which shift? How do you delegate tasks safely and effectively? What do you do when 2 team members are in conflict? It also covers managing the physical stuff, from keeping track of supplies to helping set the unit's budget. And our final pillar, ensuring quality and ethics. This is what separates a good manager from a truly great leader. This is all about setting those high professional standards. Things like conducting performance reviews that actually help people grow, communicating so clearly that you prevent errors, and, most importantly, understanding the legal and ethical duties that protect your patients, your team, and you. So, we have our knowledge map. That's our what. Now let's pivot to the most important part, the how. Because look, knowing the content is one thing, but mastering it for exam day, that requires a very specific strategy. This is your path to success. Here is your winning game plan, a simple 5-step study cycle. It starts with deep understanding, not just surface-level memorizing. Then you create short, concise notes to really lock in that knowledge. The critical step, number 3, is practicing with application-based questions. After that, you take timed mock tests to build up your speed and stamina. And finally, you revise consistently. This isn't something you do once. It's a cycle you just keep repeating. Now, if there is one thing you burn into your memory from this entire explainer, it is this: focus on clinical and practical application. The NORCET exam is not going to just ask you to define a leadership theory. No way. It's going to drop you right into a real-world scenario and ask you to solve a problem about delegation or staffing or conflict. That is the skill they're testing. This really requires a shift in how you study. You've got to aim for deep understanding, not just shallow learning. So instead of just memorizing a bunch of leadership theories, think about how those theories actually improve patient care. Instead of just listing management functions, you need to practice solving those tough delegation scenarios. That right there is the difference between passing and truly excelling. Okay, let's bring it all home. We have mapped out what you need to know, and we've built a strategy for how to learn it. So when you combine this clear knowledge map with a practical, application-focused study cycle, you're not just studying anymore, you're genuinely preparing to lead. So let's just boil it all down. Your success in this giant section comes down to 2 key things. First, structure your knowledge using those 3 pillars. That's your what. Second, master that knowledge using the 5-step study cycle. That's your how. You get those 2 things right, and you have your formula for success. And finally, I want you to remember this. The NORCET exam is just a stepping stone. You aren't just memorizing a bunch of facts for a test, you are building the foundation for your future as a nurse leader. So, as you study, think about this question. What's the first leadership skill you'll put into practice? Maybe even starting today. You've got this. Good luck.